So the neurologist saved your life after the stroke or the trance ischemic attack that you have just had. The occupational therapist will come in and look at your muscle strength, look at the movements that you were able to make, and she will start working on enhancing your muscle strength and increasing your movement. So some of the reasons why you may get referred to the OT department would be because you need help with your activities of daily living, like brushing, bathing, dressing, transitioning from the wheelchair or the bed to the commode, and of course for walking. So you may need adaptive devices in order to do them maximally, because you may be left with some redundant spasticity or slack muscle as a result of the stroke, which makes your ability to do the function with some compromise. So an occupational therapist will help you go back to what your occupation is, and due to the stroke, your fine motor skills or some of the activities are not possible. So through the adaptive devices, through mimicking the task and helping you think them through, the occupational therapist will work side by side. She will make sure you have been able to get back to your function. The rehab scenario in India is great. We have great hospitals like the Reliance Foundation HN Hospital and the Kokilaben Ambani Hospital, which have integrated therapy departments. So it's important not to get disheartened after you've got the stroke, and please set up open communication between your physiotherapist, your occupational therapist, the speech therapist, the neuropsychologist, and your orthotician. Occupational therapy will add years to your life that you have post-stroke.
The speech therapist plays a very important role in the whole team that's required for rehab. Where a speech therapist comes in is teaching a person or an individual after any sort of insult or injury or disease to communicate effectively with their caregivers and with their family. A speech therapist also helps in feeding and swallowing, because many times post an injury or an insult, these are affected. A speech therapist comes into play most often with individuals who've had a stroke, because a lot of the language areas in the brain get affected and the person may either have trouble coming out with words altogether. Speech therapists also work with people who've had any sort of brain tumor, brain injury, and also in conditions like Parkinson's disease, ALS, MS. So speech therapy, when it comes to rehab, uses sometimes what we call AAC, which is alternative augmentative communication methods, which is using a lot of apps or pictures to help a person first begin communicating before they have the words. And then we work on forming words and helping the person use their words to effectively communicate. There are a lot more multidisciplinary clinics, a lot more multidisciplinary hospitals where there's an entire team involved in the patient care. It's very, very important that a person receives support from all team members, including mental health, after any sort of brain injury and insult. If you have a family member or a friend, or you yourself are struggling with any sort of difficulty, however small it may seem, there is a lot of help available out there, which is very, very professional and good.
Neurophysiotherapy is a super specialty in the field of physiotherapy where the therapist assesses and treats the patients with disorders of brain and spinal cord. In short, these patients are being treated to enhance their function. Neurorehab is required in conditions like stroke, Parkinson's disease, multiple sclerosis, traumatic brain injury, spinal cord injury, where the therapist plans a customized program for these patients according to their functional needs to make them independent. These patients have weakness in their limbs because of impaired connections between the brain and spinal cord. A neurophysiotherapist helps these patients rebuild these connections by giving them a specific motor rehab program. Neurorehab is a long-standing process because of which it poses an economic burden on the patient's family. In India, rehab services are not covered under insurance, which becomes a major barrier for these patients to adhere for these rehab programs. Neurorehab is not a single person's job. It requires a multidisciplinary approach. There is no magic in neurorehabilitation, but you will definitely see results if you keep patience, faith in your therapist, and adhere to your program.